Podcasting from Dallas, Texas, I am Shireen, and this is the Yumlish podcast. Yumlish empowers people with chronic conditions like type 2 diabetes and heart disease to take charge of their health through diet. And this podcast is created to amplify the voices of patients, health professionals, employers, and community members who are working to reduce the risk of these chronic diseases and put your health first. Dr. Marsha-Gail Davis talks to us about her background, her efforts within preventive medicine, and then she touches upon the environment that an individual is surrounded by, be it their physical environment, their social environment, foster community, and then lastly, speaking on the impact of cultural competency on the overall outcomes of an individual. Marsha-Gail Davis, MD, is a primary care internist and preventionist. Originally from the island of Jamaica, she received her MD from the University of California, San Diego, and completed her residency in the Yale primary care residency program. She is currently completing additional training in the UCSD Preventive Medicine residency program while serving in the role of chief resident. Hi, Dr. Davis. How are you?
Good morning, Shireen. So good to speak with you today. I'm very excited.
A pleasure to have you on. I am looking forward to our discussion. So diving right in, Dr. Davis, I would love to know what led you to health and medicine.
Really, when I decided that I wanted to go into medicine, I actually thought about wanting to help my patients get healthy. That was my desire. That was my interest, because I said, as a physician, this is the way that I have impact. This is how I help people. I actually help them to stay healthy. And if they're sick, I help to bring them back to health. So that was my honest answer, my interest in becoming a physician. And I always loved biology. I'm a biology major for a reason. Like, I could talk about biology all day. I find biology so interesting, just the way things work naturally. And I think the human body is like pretty much the best, like it's the most amazing machine on the planet. And I could learn about it all day, which is what I do. So I'm just in the perfect situation. But that's really my thought, is that as a physician, this is what I'm able to do. People want to be well. People need to be well. How do I help them, get back to health? How do I heal? How do I help people? That was really my interest.
Lovely. You call yourself a preventionist. Now, I'm very curious about that term. What does it mean to be a preventionist?
I like the term. I think when people think about it, like, what is that? Versus like primary, like preventive medicine physician or a primary care doctor. Preventionist is like, it has like a little bit of a ring to it. And I like that, because overall, what a preventionist is someone who advocates for prevention, someone who believes in the power of prevention, someone who favors, policy of prevention. And that's me. I just believe we do not value prevention enough. And we kind of treat prevention like an optional thing, or we kind of treat it like, oh, that's nice. That would be nice if we could prevent some stuff, and it's like, wow, we treat it as an optional thing when it's actually something that we can place energy in, we can put resources in. And when we do that, it has so much impact. So it does baffle me a lot that there isn't this type of value that's placed on prevention, that it has this inherent value that people don't place on it. That's what I believe in, and that's what I am. And on one other thing about that, actually, I am getting a training in public health. And one of the books we have to read is by a well-known epidemiologist who wrote essentially the Introduction to Epidemiology textbook. And in it, he has a little section that talks about prevention and treatment. And what he says is that too often prevention and treatment have been seen as mutually exclusive. And that's exactly what we see in our current healthcare system. Like, either we're doing treatment, and if we do prevention, that's all in the public, that's all outside. It doesn't come together in the clinical setting as much. And yes, we have, from the standpoint of prevention, you have vaccines, you have screening, you have preventive medication. That's what we consider prevention. But in our world, our current kind of healthcare challenges, that's not enough to really combat that. Screenings are not actually dealing with what we call primary prevention. That's dealing with secondary prevention. Primary prevention is preventing the disease from developing in the first place, which I know a lot of people would like. No one wants to say, yes, I'd love some chronic disease, in 10 years. No one has that kind of attitude, And so we treated it almost as if it's okay for people to get disease. We just kind of were very nonchalant and negligent, in my opinion, about that. It's almost as if we have people walking on the side of a cliff, and we tell them that they need to walk backwards. And so if they fall off because they're walking backwards, they don't see what's happening. They're walking. We're like, oh, you're fine. They walk backwards. They fall off the cliff. We don't put any fences there. We don't give them any signs. lines. We don't say, hey, veer off to this side, stay in one line, put the fence there. So if they do happen to bump into it, they bump into it and don't fall over. That's kind of the environment that we live in. And we're just incredibly reactive and not proactive about health here.
That's a very interesting approach. I want to cover it from different lenses. So first, let's talk about the physical, right? So in terms of physical environment, how can an individual create a more health conscious environment for themselves?
I think because that comes down to kind of the individual choices in a sense, and that is just one piece of the whole puzzle. That's one block, in this wall we're trying to create that helps us to really protect ourselves from disease, because it is twofold. Your individual choices are significantly influenced by your environment, both physical and social, because that's where culture comes into play. And we know how much marketing, as you could actually speak way more than I could on that, and the power of marketing to actually change belief system. Marketing changes what people think, what they believe, a cultural thing, that's the way people live. And that's influenced so much of what we do. And then when you think about your individual choices, it's based off of those beliefs. So we can't speak to individual choices outside of that context. And I think so much of what we do is to do that. We say, food industries, usually the conversation is, you should have enough willpower to stave off not eating my food if it's not healthy for you. But there's also social responsibility, because the impact that you have is just so grand, especially when marketing dollars are being allocated. Like, there's actual investment going into marketing. So that conversation of you have to be strong enough to withstand the influences, it doesn't make any sense. So I think the first thing I talk about is just having kind of inventory on yourself. Where do you feel you are in terms of your health status? And a lot of people can determine that accurately for themselves. And when you do that, then you say to yourself, okay, like, what do I want for my health? And those questions sound like very trite, like, okay, is that going to really do anything? But what it is, it develops awareness. And awareness is very powerful. And we know that from just meditation. That's what meditation does. And when you have awareness, then you can actually start to behave differently, because you have enough time to think about what's happening so you can make a different decision. So I think once that happens, then you have to think about your physical environment. And one of the things that we are often recommended when people are trying to, change their eating habits is, when you're in the store, let that be the decision of, I'm going to determine what comes in my house, because it's better to develop what we call skill power versus relying on willpower. And that's a wonderful concept. That's one that Dr. Katz, David Katz, he speaks a lot about. And most people like the prevention community talk about. Create the environment in yourself. Make it hard for you to make the decisions that are not good for your health, but you don't really want to make. And you get frustrated every time you make them, and you get mad at yourself. Like, why did I don't want to do that? Like, you know what I mean? So there's a way that you can build kind of the system around yourself where, I didn't even bring the hot Cheetos in my house today, for this month's groceries. And you don't have access to it because it's not physically there. What happens is, when you're at home, things happen. You may get stressed. You come home from a long day of work. Your willpower is variable, and it's not going to be strong at that point. So you don't want to put yourself in a situation to be at home to have to fight. You can fight outside, but let it be that at home, it's more of an easy kind of transition, around your different choices that can push you, towards health very easily.
So that was the physical environment. I want to then hop over to sort of the social environment, the community that you're surrounded by. So what do you feel is the power of community, and how does that impact countering health disparities or even impact in health choices?
I do believe in the power of community. I just have this belief because I benefited from the power of community, especially, in this country and what we know to be the case, the reality that we all live in, and especially with all the recent conversation that was fueled by very unfortunate events. One of it was the death of George Floyd, is that we do live in a society that operates differently than we would like. We live in a society that has racial inequality that's very, very clear. And so that's an environment that we're marinating in on a regular basis. So it's not going to be easy to jump out of that. If you marinate chicken, you can't really get that stuff out of the chicken very easily. It's in there. It's so in there. And so when I think about community, I think about the ability to create kind of a micro environment that can protect you from what the outer environment may be trying to do. And I feel that that's what I would say something I've benefited from in my own rearing, my upbringing. I was raised by a wonderful, single mother who was just intelligent. She was brilliant, just in how she went about guiding, my sisters and I, toward where we are today. We owe everything to her. We're very clear. But it's just the idea that, she put things in place around us, the way that she valued education. That was something she created in our environment. environment. So when we thought about education, it's like something you need to do. This is something that's really important. The people that she surrounded us with. My mom was not about, jumping all over the place and going to any person's house. She was like, I need to know this person. I need to know who they are. I need to know their values. If I'm not clear on that, you're not going anywhere. And it's funny because like as a child, I was like, man, what's up with this? I can't even do this. Over. But as I got older, it was like, that makes so much sense because you can see how not having that type of vigilance is actually dangerous. You can't just be comfortable with having your child just go over any person's house. That's just how we were raised. I think that's just the understanding that you have to be very specific about what you're putting in someone's environment, especially child and how they develop. So my mom she just had this knowledge of that scene, and she put that into place. And as a result, my sisters and I all were able to become successful beings in society. So I think that you can do that with culture and community, where you can create a new environment. We see that happen with HBCUs. That's a new environment that's created, and you see the type of success that comes from an HBCU. Kamala Harris is the VP of the United States. She went to Howard. That is creating a community that is able to offset what the impact of the larger community could be trying to do. Those are just a couple of examples, one personal and then one more.
We talked about the physical environment, the social environment. Next, I'd like to discuss cultural competency. How does cultural competency really translate into the work that you're doing?
I think that's just so important because that is the underpinning of, I would say, or related to how bias works itself into healthcare. Because I think that's where lack of cultural understanding stems to misunderstanding. And that misunderstanding stems, I don't know how to provide care to this person in a way that will be in their best interest. And that's something that is happening on an unconscious level. As we discuss implicit bias, and that's become a real topic of conversation over the years. Actually, just my own experience in residency, as an intern, we had some conversations around that in a very kind of generic way. But towards the end of residency, there was specific effort in putting that in the curriculum, where one of our chiefs, she was chief when I was an intern, she ended up becoming faculty in our program, and she started doing a diversity series, diversity curriculum, implementing diversity curriculum in our residency. And so that was exposing a lot of people to what is bias, what does implicit bias look like? Have you ever heard of that? Like, what does that look like? And that's important because if it's done with intention to be and truly engaged, if it's more of the checkboxing, then there's no point in doing it because you're not actually thinking. But if you're engaging and thinking about it, you're going to have a different understanding when you're like, I did not think about that. Because a lot of people, we're still in this kind of culture where there's this reaction of, I don't want to be seen as someone who's racist. I don't want to be seen as someone who doesn't engage with other cultures like that. There's more of a fear of being seen that way versus actually operating in that way. It's very interesting, that the kind of a phenomenon we see. But when you become aware that everyone has bias and that's something that just have to accept, can't get away from it, then you're less defensive about someone saying, what you did there kind of concerned me because I felt like there was some bias in that. Then you're saying, oh, you know what? Thanks for pointing that out to me. Let me see how I can work on this because it's something that you have to work on. So in cultural competency, some people have said they don't like that term because it's like you have to get good at culture. It really, and that kind of can put work into it versus more of a step back and drop down where it's going to be humble about what I'm learning about somebody. I can't get good at it and then be able to tell you more about your own culture because it could be on that side. It could kind of err on that side of I now have all this knowledge and I'm going to still be in a place of being the expert. No, I'm not the expert. I'm not the expert in your life. I'm not the expert in your experiences. I need to step back. I need to step down. And I need to listen. And I need to appreciate you from the standpoint of being a human being. And then I start to build my knowledge from you teaching me.
I love it. So with Dr. Davis, we're toward the end of the episode. At this point, I'd love for our listeners to know how they can connect with you and learn more about your work.
So I am, dabbling into the IG. I joke with my friends that I'm a geriatric millennial, and I probably shouldn't say that out loud, right? But hey, it is what it is. I'm learning how to be a little bit more tech savvy with all of these things. So I'm on IG, and I really am working to let that be a community that really values, that really promotes prevention. My goal is to make prevention the priority, to bring that into the topic of conversation. The way that we have so many things now that weren't on the topic topic of the conversation that are one particular issue now is racial inequality and how that literally is the topic of conversation. The fact that he was able to get into the conversation around the election, and that was something that every question had to include that's the power of community again, that they feel that was a conversation that was brought to the forefront. So I want that to be the case of prevention. And I want to make prevention popular, because that's also cultural as well. If people think prevention is important, it will be important. So that's really my goal. And that's what I'd love for people to engage with me on and have conversations and support and share and become informed about.
Sounds great. We'll also make sure that your tags are in the show notes so people can find you there and, follow that to be able to follow you on Instagram.
It was a pleasure. Thank you, Shireen.
So with that, Dr. Davis, thank you so very, very much for your time here with us today. I do want to say this is a great note to end 2019 on. This is going to be our last 2019. God, where am I? Am I last year? This is a great note to end. This is a great note to end 2020 on. Thank you so much for your time again here with us today. So listeners, I want to talk to you for a second. Thank you so much for supporting us through 2020, through this crazy, crazy year. We'd love to interact with you. And though we're done for 2020, we want to keep the conversations going. So my question to you is, what are some of the actions you take to build a more health conscious environment in your home, especially around the holidays? Let us know with a post on social media and use the hashtag conquering chronic illness. I'm going to say that again. Hashtag conquering chronic illness. And don't forget, tag us. And to know our tags, again, go to the show notes. So with that, thank you so very much for your time and for listening to us.
This episode of the Yumlish podcast is made possible by Anchor. Anchor is a free and easy way to create a podcast. Their creation tools allow you to record and edit your podcast right from your phone or computer. Anchor also distributes your podcast for you, so it can be heard across Spotify, Apple Podcasts, and many more. It's everything you need to make a podcast all in one place. Download the free Anchor app or go to anchor.fm to get started. Thank you for listening to the Yumlish podcast with Shireen. If you like our show and want to learn more, you can find information at yumlish.com. You can also leave us a review here. We will see you at the next one. And remember, your health always comes first.
So find Yumlish on all the social media accounts linked in our podcast show notes. Our Yumlish socials help you learn more about our mission at Yumlish, keep you updated on helpful tips for managing your diabetes and giving you access to exciting opportunities with Yumlish. With that, to our listeners in Texas, Yumlish will be running a diabetes management course here in the Dallas region. If you are interested, email us at info@yumlish.com and we'll connect you over to that. Lastly, if you enjoy Yumlish podcasts and know a healthcare expert working in the nutrition space, reach out to us on Instagram to nominate them. Send us a DM telling us who you want to nominate, what they do, and why you believe their work is making a difference in the lives of individuals to conquer chronic illness. Thank you again. Until next time, stay well.